So I'm just taking my thymus and alpha and my glow and some for healing. And I'm gonna do a stem cell infusion on myself probably in like 2 weeks. But no, I'm always
Gonna
like
do it
this
on
after surgery, like after
yourself. Oh my
my
God.
meniscus surgery, I walked myself to the bathroom the same day.
That's awesome. That means your healing's gonna be really fast, right?
I hope so. Like my drains, I only have like I drained them just now and I drained them at 1 a.m. and it's only 10 milliliters come out. So just a tiny, tiny bit. I'll show you in just a second.
Oh wow.
Once I'm
Nothing.
done poking myself. I just got my Mott C left. How was y'all's weekend?
No, I was supposed to have a doctor's appointment today. It was good. What did we do this weekend?
You had some family time, yeah?
I think I did jack shit.
That's
I
nice.
think was that list? I think that was the weekend before. Yeah. This weekend we did nothing. Last weekend Cora's parents and family was here. That was lovely. It was great. Right now we're just packing our house. We're moving on the 31st. So,
Oh yeah, that's next Wednesday, huh?
and we're both so excited. Yeah,
I'm
we're
excited
both so
too.
excited. We're ready to get the hell out of here.
So this is my dressings before I button myself back up.
Oh my God.
I had to put a sock over here because it was cutting into that nerve under my armpit, and it was like
Mm,
I felt like I had like a
the
pinched
bandage.
subscap, like where it was making my
Mm-hmm.
arm go cold. Ooh,
Did your
it's rough.
doctor talk to you after the surgery or you don't
No, I was
remember?
supposed to. I actually don't remember. He called my friend that drove me. But yeah, it's sore. It's real rough. It's real heavy. Um, I'm due for
Mm-hmm.
pain meds right now though, so I'll probably take them here in a second.
You should take those. You got to get ahead of those. Yeah. Don't let that lapse. Get ahead and take those. Um,
And my
and
antibiotic.
you're managing all your own drugs. You're like your own nurse. That's crazy. I was a little
Yeah.
baby. I needed a lot.
I wonder if I'm like supposed to be doing as much as I'm doing because like I don't want to push it and not heal, but I feel like I should be able to use my arms. I tell you what though, yesterday I thought I messed up bad because
Why?
we got toothpaste in the corner of my mouth. Um, we were driving to Metro Atlanta and it's like peak hours for lunch coming off and then coming out of it and I'm out of breath, but I know it's just because I'm like
Yeah. It's a pressure. Yeah.
mhm. I can't take like a deep breath at all and trying to talk. I haven't talked that much.
Mm-hmm.
Um, but the car in front of us swerved really, really hard
Oh
to the
no.
left because he was about to hit the car in front of him. So obviously we didn't see that the car in front of him was completely stopped. And of course my arm shot up to grab my oh crap handle. And I was like, oh no. I was like, oops, I hope I didn't just mess up something. But nothing like popped or anything. So
Yeah, popping would be bad. We don't want any type of popping sensation right now. That would be pretty bad.
so I did it again. I put sugar-free Ready Whip in my coffee. So it's that, not toothpaste.
Yeah.
Um, Next week, I booked Austin Espy.
Oh, good.
I'm so excited for him to come talk to
Hmm.
us, but he's in Central Time, and I booked him the same time as my post-op. So I think he's not available any later. I'm gonna try to see what his availability is Thursday. You think that's okay?
Um, that might be slightly harder for me next week just because we're moving on the 31st. So I don't exactly know what the first is going to look
Oh yeah, yeah,
like.
yeah. Duh.
So I would hate to commit to that, unfortunately.
That's fine.
I could do later on Tuesday or
I'll see if he's like available later because it's not like I can train or anything anyway. Um,
hmm
so. I'll get with him. We'll
I can
because
pretty much
I'm
do any time on Tuesday because we'll still
yeah.
be here doing whatever. So
I figure I'm wide open after like lunchtime.
yeah, okay, that will be cool. It'll be fun. Did you ever talk to Meg?
No, because I was trying to get because I accidentally booked her and Carissa the same day, so I told myself
Uh-huh.
only book one at a time now.
Mm,
But I do think depending on what time we do it next week, Tanya may join us. Her in-laws are in town right now for Christmas.
yeah,
We
it's
had
hard with the holidays for everyone. So
everybody loved my nail polish. I didn't get fussed
it's
at for having anything on there.
oh good.
Um, I had to sign a waiver for my earrings. I got there at 5:30 yesterday. I was home by like 2. I think I was out of the OR by like 11:30. Um, Felt great yesterday for the most part. And
Hmm.
then like pain started kicking in, I think about 8 o'clock last night. I was like, I guess my anesthesia was wearing off.
Yep.
But I was so glad that they canceled my appointment today because I was like, they called and he said, well, it's his nurse, but she was like, we're not going to do anything but check on you. We know where you live
Hmm.
further away. They're like, we're okay if you want to come back at your appointment Friday. And I was like, I don't have an appointment Friday. My appointment's for next Tuesday. And
Hmm.
she was like, ooh, I don't know if he'll want to go that long. And I was like, I think he'll be okay with it if all he's going to do is look at me because he knows what I do for a living. And I was like, but just double check because if y'all need me to come, I'll make it work. I
Hmm.
was like, but I got patients booked Friday right now.
Yeah. I mean,
So
are you going to change the bandages at all, or do they want to keep
I don't think
like?
I can do anything with it. Like I think the bandages have to.
Because he probably
And
wants to see like your nipples and stuff, though. You know what
so
I
I'm
mean? Just to
thinking
make sure the blood flow is good.
I'm not going to see what they're going to look like until the 30th.
I'm saying, doesn't he want to check because they want to make sure like the blood flow is good to the
Oh,
nips?
I would know if it wasn't.
Oh, okay.
Yeah, it'd be very painful.
Hmm.
But no, I think I've got like a Curlex rigged bra under the band, and I can very much tell you it's the band is uncomfortable, but I know that I need it
Hmm.
because of gravity on these things right now.
Yeah.
Because just standing, like I just want to sit here and like hold them.
Yeah. The pressure. It's a lot of
Hmm.
pressure. It's gonna take probably like 6 months before they feel like they're here, like a part of your body completely.
I know it's gonna be interesting healing time, but I I was under the understanding that the pain was gonna be a lot worse. But again, I do think I just
Hmm.
all the GH and peptides and stuff because I've been taking
Hmm.
blow for 2 months coming into this to prepare. So
And you don't seem to have like a reaction to like anesthesia or the drugs or whatever. I think you just like you don't get like bad side effects.
no, I woke up and I was just awake. Like I was like, okay,
Yeah.
I'm good. I get a little groggy with the pain meds, but
Yeah. They don't make you nauseous or anything.
no, I haven't needed Zofran at all. I don't really
Okay.
throw up like that. That's why Vegas was such a like crazy
Yeah.
thing because I don't
Hmm.
throw up. But I want to see what they look like. But on a related but unrelated note, I think I have decided that I don't like the molded cup tops for my posing suits.
Oh, really?
I don't think I'm gonna like them now because they
Was
don't
the red
move.
one molded?
Every new one I bought was molded.
Okay.
Because I thought it would help. But what
Mm,
I've noticed is the molded cups don't move with you,
yeah.
and I don't
So
like
it like
that.
stays down there and then your
And it
boob
like
goes wherever it wants to go.
yeah, yeah.
Yeah.
So I think now that they're redone, I might have her cut me a red and pink top that's just triangle. I don't need
Hmm.
four tops, but just those two because those are the two. I like using the pink for posing suit, and I think I'll move to the red for prep.
It'll be interesting though, because if your boob stays like where it's supposed to stay and your front relaxed, then the molded cup might be good.
It
I
could
don't
be.
know.
Yeah,
You know what I mean?
I'll play with
That's the
them.
dream.
I'll play with them and see.
Hmm. Well,
I
good.
got out of anesthesia, and when I went into the OR, I had 0 messages on my phone.
Hmm.
When I let her hand me my phone at 12:30, I had 67 messages.
Jeez. That's good that business is so good though.
Yeah.
Sorry, I'm eating. I really tried not to do this, but I have a doctor's appointment now this afternoon. So, or actually was, I don't really know what I'm supposed to do because I was telling Corey that my appointment's supposed to be at 9:40, and then they texted me and said, can you come at 11 instead? And I said, yeah, that's actually better. But then they never responded after that. So
Yeah,
now
I
I
hate
don't
when that happens.
know. I don't know what time, and it's kind of far away. So I don't know what to do. Ooh.
They moved it. Sorry. Now you don't know
I
if
don't
when
know
to
because they
go.
didn't respond back. And usually they send like like a text or an email notification of like a changed appointment.
Yeah.
But they text me at like in the yesterday I was just like crazy slammed at the salon, so I didn't see it for a couple of hours. So I think they were already gone. I text back at like 3:40, so I think they were already gone out of the office by then. And that's why they didn't text back.
Yeah.
But it's so far away that I have to leave like right at 9 o'clock if my appointment's at 9:40.
Yeah.
So I just
Well,
don't know what the fuck to do.
you can put Corey on the podcast and we can talk about his surgery and you can go call them and see if they're
Yeah,
going to see you
he has.
early.
They're not there yet. They don't get there until 9.
Oh, well.
So I don't know. That's why I'm like I don't know what to, and if I it's going to be annoying to go there at 9, get there at 9:40, and then they're like, "Oh, your appointment's not till 11." Like,
Yeah.
oh,
And then you
great.
just got to sit there.
But it's literally so far away. Um,
Looking for a
his
pen.
belly button looks awesome. It's
Good.
really great. Yeah, it's just a perfect aesthetic
Does
tight
he
little
have an,
belly button.
does he have an innie now?
He does have an innie. It's
Has he ever had
gorgeous.
an innie? As long as he's
Yeah,
been.
no, he had a normal belly button up until it started coming out until like I don't know, like 2 years ago.
Mm,
Um, and then I think at first we just thought like because he was getting more muscular that it was just his belly button was just like growing because he was like getting big abs and stuff like that.
that's
And
funny.
then it was like, oh wait, no, that's definitely a hernia. So no, it's going great. He went to the gym for the first time yesterday.
I'm sure that made
11
him
days
super
out.
happy. Yeah.
Yeah.
He was itching.
Yeah, it was getting a little crazy. I was like, you gotta go to the gym. Like he's sitting right here so he can hear everything I'm saying. He was starting to drive me a little bit crazy.
I'm
Oh,
excited to see how he does on the follistatin.
yeah. We're all excited. He's very excited for his next cycle coming up with everything with the peptides and
Hmm.
like Justin increased his food finally yesterday because it was his first day back in the gym and they're just ready to grow. Did you are you what's the difference between I was telling him about the PT or whatever, I can't remember what I wrote it
The
down, but
FR,
oh
GR.
yeah. What's the difference with that and follistatin? Because when we researched it, it basically just says it's follistatin.
Yeah, they're very, very similar. But there's some component that's in follistatin that's missing out of the fragmented one that interferes with the sex hormones as much. So it inhibits the I'm trying really hard. My brain's trying really, really hard to work with these
Yeah.
drugs. You still get the myostatin benefits, the unlocking of that, without
Yeah.
the drive up of androgens, I believe. Now, I still need to do more research on it because I haven't yet, but I do think it'd be really cool to talk about.
Yeah.
Um, and I have Austin on follistatin, so he'll be
Oh,
able to talk next week about because we're going to talk about his Olympia prep, Olympia experience, and then what his protocol is right now.
okay. Do you work with who's his coach?
Will Sage,
You froze, my lady.
Will Sage.
Oh, okay. Do you work with him on like the protocols or no?
I wrote Austin's off-season protocol.
Okay.
Well, I mean, of course, he's
Awesome.
got some other things thrown in there, but
Yeah.
from my side, he was,
Mm-hmm.
this is why I wanted him to talk because he was like,
Mm-hmm.
here, this is what me and Will talked about. You tailor it. And so we kind of customize, we're going to do this for this long, this for this long,
Mm-hmm.
and try to kind of unlock that potential, like, because he's got a great frame, but
Mm-hmm.
he's going to be like, I think we were trying to get 40 pounds on him for the off season before he cut
Wow.
because he
Mm-hmm.
came in under his weight cap. So I think he's still got a good 7 pounds of tissue he can put on.
Yeah. That's gonna be awesome. So the full statin though, that's only like a 4 week cycle, or it should be longer than that.
I'm doing 12 weeks on him, but I'm not
Okay.
dosing him like we're dosing Corey.
Okay.
I'm almost micro dosing Austin.
Okay.
And if Corey starts feeling poorly on it, have him take thymosin
Mm-hmm.
alpha with it because it
Yeah.
does downregulate the immune system. So thymosin alpha would be a really good one to
Mm-hmm.
stack.
Yeah. And does it have like he was researching and it has like negative effects on the liver, the lipids?
That's anything that increases
Mm-hmm.
muscle mass, though.
Okay.
That's why we take like
Like everything.
revive liver and stuff. Yeah.
Mm-hmm. And all the things.
But if he took something like tesamorelin with it, tesamorelin cleanses the liver.
Okay. You can take Tesla with regular growth hormone though?
Yeah.
Um, Oh, okay. Interesting. I didn't think you could combine those two really,
Yeah,
or that you
because
should.
TH is super short acting and tesamorelin, they're long acting secretagogues. So it's kind of like taking testosterone and clomiphene together. You
Uh-huh.
maintain and support some natural function while also bolusing the hormone.
Oh, wow. Okay.
I actually call
Interesting.
GH peptides like I'm like it's like the enclomiphene or HCG of tests because that helps men
Okay, that's what
understand
it
it
does.
better.
It's
Yeah.
like, yeah, exactly. Exactly. No, we're both really excited. I feel like that's what's like when we get in our new house in January and going into builds and like everything, living and
And I get to
working out
meet
in
you
the same
guys and
city.
I get to meet
I
you guys in person this
know.
weekend.
He's really excited for the stem cells. His hip is making him crazy, so we're both very excited and hoping that they do a lot. So,
Yeah, usually within 2 weeks, people start noticing. I've had people notice the
mm,
next day, but then they're like, "Is this a placebo effect?" And I'm like,
right.
"Maybe," but no, a
My
good
friend
two
was
weeks.
telling me that her mother-in-law, they did them right in her feet, like directly into her feet, because
Yeah,
she had
you can
like
joint.
tons of feet problems. And it's been like, she said within like 48 hours, she had no pain in her feet. And it's been four
Yeah,
months.
so it's kind of like we have what we have are stem cell exosomes, and they vary
Hmm.
slightly from stem cells because stem cells have exosomes inside of them. They're what trigger
Hmm.
the communication between to repair and restore tissue. And so, but when you have stem cells, it's almost like giving yourself a component of someone's blood. And so
Hmm.
you are at a higher risk of having a reaction. Stem cells are tumorigenic, meaning they can cause tumor cell growth. Whereas exosomes are just the tiny vesicles that cross through into the cells to kind of stimulate and communicate that they need to regenerate and repair. And
Mm,
so you don't have the side effects or the risk of cancer, but you get the benefits of the repair and reduce inflammation. They're like little
gotcha.
Pac-Man.
Yeah. That just go in and get rid of everything.
Hmm.
Well, we're very, very excited. We're excited to meet you and excited to um get his stem cells and hopefully because it's like you know how it is. Like when you have that one, you finally like, okay, this is it. Like I'm gonna be go into my growth, and then you have the one thing like feel like holding you back. It's the
Yeah.
worst.
I think he's
The
gonna be really
worst.
happy with it. And he's doing glow
Yeah.
too, right?
Yes. I'll have to send you his. It's extensive list.
I get
Glow.
it.
Do you do BPC and glow?
BBC's
No.
in glow, but
Just
you
glow.
can stack it. But like this is my little thing.
Mm-hmm. There's a lot. What are you taking? Yeah. Just the glow. I mean, just the BPC and KPV and retatrutide.
Retta, Retta. I had a bunch of people's labs to go over to.
I need to do labs too before I do my uh in January. That's my next plan.
You can check labs on you whenever.
Yeah.
I told you last week, I think I got like a $1,400 panel. Some of these labs get so expensive. Like
$1,400.
a reverse T3 by itself is $160.
Oh my God. Girl, I'm trying to spend like $175.
We'll do the plus panel. Cholesterol, A1C.
$1,400.
Yeah.
That's insane.
Yeah. I don't
Good
get a discount
gracious.
on lab work either though. Because
Jeez.
we don't actually mark up our labs at all. We literally turn around and give them everything that we charge.
Did you get the results you were hoping for with all that information? Like, did you get all the information you wanted to get?
Yeah, I mean it was literally
Oh.
everything. So my T4 was high and T3 was a little high, T4 was a little low because my T3 was high. But it's
Mm,
because I'm on NP thyroid.
mm,
So my cortisol was super high, but I think it was stress related.
mm-hmm.
Because I've had this surgery, and I did tell him I was like, I am one of those people that live in a perpetual state of stress, but I don't
Mm-hmm.
register it as stress because I'm not unhappy.
Yeah.
Like I'm perfectly happy doing what I'm doing, but almost the more frantic I feel, the more productive I am.
Mm-hmm.
It's just like an
Yeah.
ADHD trait.
Yeah. Absolutely. It does have a massive effect on the body, even when you don't realize that it is, though. Like, you just don't realize, like, until you're not carrying that amount of stress with you, like what it feels like and what it's supposed to feel
Hmm.
like.
And my HRV is like on my Aura ring. It always says it's like
Mm-hmm.
15 to 20, which is really not consistent with life, you know. But I
Mm-hmm.
was reading that women that have like chronic neck pain, poor HRV, and those kind of symptoms do live in just like a perpetual state of stress. And so I'm just like trying now to not be so intense, I guess, you know.
Mm-hmm.
But at the same time, it's just like the way I'm wired. I
But do
do
you think that has
better.
gone back down with your career change, though?
Yes and no, because I'm
Mm-hmm.
these patients, like I'm always busy, you know, like
Mm-hmm.
that wasn't those refill reminders. Those were just 67 people trying to contact me within 4 hours. So like, that's why I think it's funny. People are like, hey, do you have time for a quick call? I'm like, I really don't. My days are
No.
scheduled down to the minute. Like, yeah, I have time in 3 days. You want to book it, you know?
Yeah.
Um, but again, it's
It
not
is
like a
wild the things that people could Google and they just don't. I mean, that's very fucking annoying. I'm not even gonna lie. Like, I should say this for the 5 people that watch our podcast. Like, do a Google search or Chat GPT. It's very, very easy. Like,
people are
it's
not resourceful at all. But at the
Google
same,
and Chat GPT. I
it
mean, come on.
it depends on their question, you know. I what I don't like is when people say, "Hey, do y'all have GLPs?" and they're texting me and they've signed up for something else because
Hmm.
like specifically with the GLPs, that's not something I'm just going to text you info on because that's a 30-minute appointment with education.
Hmm.
And like us as athletes, I don't worry about
Hmm.
us so much. I know we're going to eat right, but other
Right.
people, I'm not putting them on a GLP without that education that they still have to eat. They
Hmm.
still got to prioritize protein. We have to taper it down. We can't just stop it. So I'm not just going to prescribe you a GLP.
Right.
Like I will do it, but not without educating you first. Can we
And it's not just like a
appreciate?
one-time, like 5 minute. They're going to be very high, high to the sky, my lady. That's the fun part.
They're also being like squeezed in and up too. So I'm just like,
Hmm.
please stay here. But I
Yeah.
told Zachary, I was like, it's gonna be like vacuuming out the couch when I take this off. Like I've already dropped like several grains of rice down there.
Just like a little snack
The
for
little tube
later.
is gonna be like like all the crumbs that are in my chest. Dr. Kristen's gonna be like,
Like he goes to take the bandage off and like shit just falls out of
rice,
your.
dried rice is sprinkling down.
He's like, oh, lovely. Like just a couple of grains of rice.
Yeah.
No big deal. But yeah, no, Google are asking you like dumb, like where can they get? No, no, just where do I buy syringes from? What like it's just too it's too much with all the questions. People got to Google search some things. But yeah, and the things that seem like they're like 5 minute, they seem like they're a simple answer. They're not a simple answer.
Mm-mm.
They're a full on conversation. Like even like you were saying with the GLPs, like explaining to somebody that doesn't know what's going on or has never been on one.
Yeah, and then another thing we talked about before is like medical math. Like people don't know the difference, but that
Hmm.
doesn't bug me as much because it's not their responsibility to know.
Uh-huh.
But what I don't like is I'll get a random text from a patient, and yes, I can go in and look it up or whatever, but they're like, "How many units am I supposed to take of this?" I love that you assume that I just remember everything I prescribed to everybody. So if you could text me and say, "Hey, I got
Oh.
my TB 500. How much do I take?" But it's like, "Hey, now what do I
Hmm.
take of this?" And I'm just like, "Well, hang on. Let me go find out what it was I prescribed you." And I always make
Well,
them
and you
send me
probably
back.
already told them in a text message or in a phone call and
It's
that they didn't write
written.
down.
It's
Right
written on the pill
on the
bottle. Like
bottle. Yeah.
everything comes like labeled, right? But it comes in a pill bottle, and the pill bottle has the script on it. Um,
In
but
units.
sometimes they throw that away or whatever.
Hmm.
So I'll be like, "Can you send me a picture of your bottle?" And I'll tell you exactly how much to inject.
Hmm. It's a huge benefit to have you to be able to do that, though. It really is. I don't think people realize.
Yeah, they don't, but it's okay.
Mm-mm.
There's we had the best time with my niece. They gave
Did you guys
her
do your Christmas?
they gave her a ball pit.
Oh my God, that's the best.
She was so happy. Watch this video.
Yeah,
Let's see if it'll play.
put it up a little bit.
She's right there. Well, it gets
Oh, there you go. Oh, oh, there we go. There we go. Oh my gosh. That's probably all they had to get her.
Yes, it was so fun though. But we did our Christmas this past weekend, um, so that we could actually do it, you know.
Mm-hmm.
And then my
Oh, that's good. I'm
girlfriend spent
glad
the
you.
day with me yesterday, and Zachary's been such a champ, and he's watching the Twilight movies with me. I forgot how
Oh,
awful they are.
yeah,
Like they were so good to me when I was like a teenager, and I'm watching them now, and I'm like, these movies are bad. Like
yeah,
they're really just like a teen romance. There's like no action. I just love the wolves. I love watching them change into wolves because
yeah.
I love wolves. Like I do. I have like I'm a sucker for them. Like anything werewolf, I think it's so
Mm-hmm.
cool. Like Underworld, those types of
Werewolves
movies.
and raccoons, your two loves.
I will own one.
Maybe because the raccoon's like a little mini version, a household
Right.
version of a wolf.
Zachary was sending me videos of little prairie dogs, and they're like, "Whoa!" Like, they want you to pick them up. Like, so cute. I gotta send you the video. But they woo at you.
Oh my God.
Where did he send he sends me a lot of YouTube videos.
Do you have an appetite? Are you just staying like, are you sticking on your diet 100%? Or are you like eating a little bit, just eating what you can right now?
So I gave myself Saturday with my family,
Mm,
and I gave myself yesterday as like my Christmas day. So
hmm.
I think I ate like
You
three
wanted to
big
eat yesterday?
I was starving. I got Greek
Hmm.
food, so I could get it's just jasmine
Hmm.
rice, and
Yeah.
grilled chicken. And I had my meals prepped, and my mom cooked me a big old
Hmm.
pot of vegetable soup, so I did eat a bowl of that. But yeah, I was starving by like the evening. I ate
Hmm.
three cookie icing sandwiches, three of them,
Cookie sandwiches?
with the icing in the middle.
Oh, like from Great American Cookie Company?
There were three double doozies. I tore them up. They were
Oh,
so
you ate
yummy.
all three of them?
Yep.
Damn.
And I didn't even get sick at my stomach.
I
I
don't
was
know
like,
how.
I'm like eating them. I'm like, I deserve this.
All three of them.
Yeah. Well, what I do is I eat the tops off.
Were they like the little ones?
No.
Oh, regular
I
size.
appreciate you
Okay.
trying to give me some credit, but no, I ate the big ones. I eat the tops off, and then I eat the bottoms with the
I
icing
do not
on.
know how your stomach did. I would be so sick from that amount of sugar. Like it would just, I'd
Yeah,
want it, but my
usually
stomach would
one,
pay.
and you're like, but
Hmm.
I just I tore it up. But yeah, I'm
Well,
back
it was
on
also
plan
the
today.
drugs too. Yeah.
I'm back on plan today because I really don't want to gain any weight, and so, if I can stick
Hmm.
right around where I'm at, maybe give or take 5 pounds, I'll be all right.
Hmm. Yeah. I'm
And
sure
it'll
you'll
come
do
back off
fine.
when I'm training again, but.
I am bringing you a few treats that you have to eat, so you'll have to make room for those.
Well,
Yeah.
we'll have our cheat meal. We'll go
Yeah.
somewhere other than Culver's.
Okay. Yeah. You guys have Culver's by you?
We do.
We
It's
do
not.
be loving Culver's. I'm actually gonna, there's no Culver's in Myrtle Beach, so we went there
Oh,
like last week, and I was like,
so
my Culver's.
I've never had Culver's, but my husband loves it. So,
Okay, now you have to try it at least. It is so good.
say I'm not a
Are you
burger
not?
person.
Yeah. Oh, okay. Really? They have other things though. It's just fresh. Like if you're gonna have fast food, it is like the freshest fast food. That's what's good about it, honestly.
I mean, I'll try it, but
And
I
it's not
might
as
just go somewhere
greasy
and get
as
me some
Five
chicken.
Guys.
Yeah, I can't.
Mm-mm. It's just fresher. Like you feel like you're eating at like an actual restaurant, I feel like. And it never, the most important thing is it does not fuck up either one of our stomachs, which is very rare. Is usually one thing or another does. But I hope you're feeling good by then.
I mean, if I feel like I figure today and tomorrow my fingers are a little swollen, but it's honestly
Mm-hmm.
probably more from the double doozies than it is the anesthesia.
The double doozies.
I was honestly surprised that my stomach wasn't
Yeah,
like I still have my abs. I was like, okay, I
yeah.
think it's the drains. Um, but you said
No, it
something.
looks really good.
I'm
It
anxious to
looks
see
really good.
them, and I'm excited to have you wash my hair.
Yeah. Are you gonna be comfortable to like put that head over a sink or something? What are
I
you gonna
don't know.
do?
We'll have to figure it out. My kitchen sink's
Yeah,
pretty high.
yeah.
I think if I just like bend down,
When can
and
you get in the shower?
worst case scenario is I can't get in the shower at all because I'll have my bandages on.
Dang. Yeah,
So
we'll
we'll
figure
figure it
something
out. I
out.
mean, worst case
Mm.
scenario is I'll just rock and roll it. It's not like I'm sweating it or anything, you know. I was
Mm-hmm.
asking Zachary, I was like, "Are you going to put my silk bonnet on for me so I can sleep?"
Did you do it?
We're going to try it tonight.
Oh, okay.
I waited till I had gotten I had laid all the way down and I was finally like, oh. And then I was like, my bonnet. And then he was like, okay, what do you want me to do? I was like, nothing, just let it go. I'll go one night without it. But it's really just because I get tangled up in my hair. Like it gets under my armpit, around my neck, all those things.
Yeah. Even just put it in like a loose braid or something like that.
I did think about asking you to give me like a French braid pigtails or something.
Yeah. That actually that might be annoying after a couple. Well, no, for like 2 days it'll be fine. 2, 3 days. Either one.
Yeah.
I'm texting my assistant to remind me to bring home my tools on Friday though.
Oh yeah, yeah, yeah.
Otherwise I will forget. When you just reminded me, so if I don't text her right now when I'm thinking about it, I will forget.
What time are y'all gonna leave Friday? I mean Saturday.
We're coming on
Sorry.
Saturday.
Yeah.
Yeah. Probably like the ass crack. What time do you want
No,
to
I'm
leave on
sorry.
Saturday, babe?
What time do you leave work on Friday?
I don't have to go look. I think like 4 or 5-ish.
Okay. Well, I'm gonna text you at 4:30.
Okay.
Okay. I'm trying to think of what else. I wanted to talk about the surgery, but there's not really a whole lot to say other than it is a lot more pain than like a normal breast augmentation.
Hmm.
But
Well, and the recovery is
it's not,
definitely more intense.
yeah,
It's going to take longer to recover.
it's not excruciating, you know.
Hmm.
I am going to take a really good nap after this, but
Hmm.
I, I'm trying to like stay on top of morph a little bit without like overdoing it
Hmm.
myself because I will. And, but my refill reminders go out in a few minutes and
Did
I
you
have,
take actual like vacation days from there or like sick days or anything?
so the way that it works is like I'm not seeing new patients until Christmas, so I'm
Mm.
not taking on new ones. But if I don't reply to my patients, nobody will. And I'm not going to let them go 3 or 4 days without getting an answer from me. Like, because it's just a text message, you know what I mean?
Dang. You don't have like an assistant or anything?
No, I do have one of the office assistants that does, she's office assistant for the company.
Excuse
I
me.
asked her, I was like, can you just keep an eye on my messages? And if there's anything like
Mm.
urgent, or if someone seems like they're getting irritated that I'm not responding, can you just let them know? Um,
Yeah.
because my patients are so used
Well,
to
I'm
me
sure a lot of
doing,
them know that they're having surgery.
a lot of them follow me on Instagram, but not
Yeah.
all of them.
I always wonder if the people that I refer to you actually um contact you.
Um,
Because so many people say they like want help and they'll like talk to me for hours about how they need help. And then I'm like, okay, this person will help you and it's so easy. And then I'm like, they ever actually, 'cause I feel like I'm finding that a lot of people want to talk about getting help and making changes, but then don't ever actually take action on that for whatever reason. Doesn't make any
yeah,
sense.
they just want to give you the excuses as to why they're not.
Hmm. But I'm literally like, okay, this is the easiest. All like she will call you in blood work, and you just show up at LabCorp, and then the blood work goes right there, and then you have a phone call, and then you have all the answers that you need. It's super simple. It could not be easier. Like, I don't even know. Like, what more do you want? You can get answers for all of your issues.
Yeah, and I think two
Mm,
people don't know that about me yet, but I actually enjoy educating. So
mm-hmm.
um I like when my patients reach out and ask me questions, and I like when patients are, I don't like the ones that go too deep into like Google searches and,
Well, I
they
also
come to me.
question your responses.
I don't want them coming to me acting like they know everything when they don't,
Mm-hmm.
you know. But I do like when patients want to learn about something and they ask hard questions. I'm like, I like when my patients challenge me because it makes me better.
Mm-hmm. Yeah, definitely. But like questioning you once you do give responses, I know that's annoying as hell.
I'm like, oh, sorry, did you go to med school? No? Okay, then.
Because you asked your cousin's boyfriend who's a nurse at
And
whatever.
there's a lot of people now getting into that like functional coaching or whatever, and they
Hmm.
really think that they know a lot, and some of them do. Some of them have really done research and are very intelligent and have figured it out, like Justin Mahaley, he's good.
Mm-hmm. Mm-hmm.
And I think Megan Morrison is smart,
Mm-hmm.
but there's a lot of them too that don't know what they're doing at all.
Mm-hmm. Was
You
Megan Morrison his former girlfriend? Is that her last name? Justin Mahaley's?
No, Meg Scooby Prep.
Oh, Meg. Okay, sorry.
Yeah, I don't keep up with Justin's
That wasn't her.
personal.
I was thinking her last name was something. It's like what was it before? Like
Oh my
San
gosh,
Diego. It's
something
like
like that.
what was
Something like
it?
that.
That's what
Santa
I was
Barbara or
Santa
something.
Barbara. Yeah. Oh, I was thinking about Justin McHale's ex former girlfriend was Meg, and she's catching so much shit because she's the one who recorded that video of the obese nurse walking down the hallway.
That was her that did that.
Yes.
That was sad.
Yeah.
People are so mean.
Yeah. 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 She's getting like some major heat. I don't it very I do see her content, and it never has struck me as being like bullying. I think she meant it in a different context. Well, no, she meant it in that context, but I don't know. I get her point and I agree with it to a degree, but it was like, ooh, that was definitely like a bad move on your part. I saw that Joey Swoll stitched it yesterday and he had like thousands of comments just ripping her apart. Like, oh God.
Yeah, people just mind your business. You know what I mean?
Well, also like you can't, no matter what, I think more people are pissed because it's like she is a nurse. And because that was her whole point, like how can somebody in healthcare that doesn't take care of themselves? But like people are very protective of nurses. It's kind of like firefighters and teachers. Like it's either like your mom, your sister, like you know what I mean? Like somebody you're close to is an aunt, there's a nurse. So like I think that was a big thing too, is like people didn't like her coming for a nurse and like how hard they work.
Yeah. And it's again going like you never know what people are going through either. Luckily that lady didn't see it,
Mhm.
but as viral as it gets,
She
like
probably
she
has
might
now.
have, and it's just like,
Hmm. I guarantee you, she has now. I say, Lily, finally woke up. Lily.
a lot of these I'm getting right now are just shipping notifications. So there's a couple of like bigger questions I got asked yesterday, and I was like, y'all just gonna have to wait. I can't answer all that right now. I'm
It
answering
is not.
quick little
It's not
things.
safe for me to answer this question right
Yeah,
now.
and I'm not doing any lab reviews until Friday.
Mm,
So I got two marked down for Christmas because I know that those two people aren't doing anything for Christmas. And so I'm just gonna be laid in bed. I actually had a patient book and they were like, are you sure it's okay? That's Christmas. And the office girl had asked me, hey, do you want me to close down Christmas? I noticed you accidentally left it open. And I was like, no, I actually opened it on purpose because I'm just gonna be
yeah,
laid in bed. And that might be the only day some of these people
it'll
can get
distract
in.
me. Yeah.
Yeah. And honestly, like it gives them, if they're alone, it gives them somebody to talk to.
Mm-hmm. Oh, oh, you're like, let's get on a phone call.
Yeah, like let's just chit chat. Just don't mind me on my video
Exactly.
calls if I'm like, what's your height and weight? What's your height and weight? What's your height and weight?
Do you and your husband get each other Christmas presents?
We do Christmas birthday valibirthday gifts.
Oh, it's like a giant all together.
Yeah, like I got
It
him
it happens on Christmas.
oh no, he got this back in October
Okay.
because one, I can't hide anything ever. As soon as I get it, I want to give it to
You want to give
somebody.
it immediately.
But two, I was in Dallas when it got delivered, so he was gonna see it because he had to sign for it. So it was like, you're already gonna know what it is. Might as
Mm-hmm.
well use it. But I got in the Xbox ROG. It's literally a computer. Like it has Windows on it.
Mm-hmm.
But he can play his video games anywhere and everywhere. And it gives him something to do when I'm dragging him to shows
Mm-hmm.
and stuff like that. So he got that, and we got a like a luggage rack for the expedition.
Oh, I haven't heard of that Xbox thing. Xbox Rogue, it's called?
ROG. It's like
Oh, ROG.
and I think it's called like a Ally, ALLYX or something. I don't know. I'm not into video
Mm-hmm.
games at all, but that's his
Mm-mm.
thing, and he loves it. You
Yeah.
can see it this weekend.
Mm-hmm.
Um, but he plays like some like shoot 'em up game. I don't know. I would play like the Hogwarts game probably, but
Yeah.
I'd rather listen to my audiobooks, but it don't bother me that I'm like, you can play all day. Do your
We
thing,
did
baby.
Corey downloaded we did try to play like some of his games on there, but I just it's he gets so competitive and he won't teach me. So then of course I'm gonna like die within two
That's
seconds.
funny.
So that's what doesn't make it fun is I don't know what I'm doing and I'm playing with like a freaking expert gamer. Like why, who's
That and
like
like
competitive.
first person POV is very difficult for me.
Hmm.
I like third person. I want to be able to see everything
Hmm.
around my little person.
Yeah.
Um, so
We play Family Feud and Wheel or yeah, Family Feud and Wheel of Fortune on there. That was very still gets competitive, but not
I'm
somebody's not dying every 5 seconds, meaning
right.
me.
Yeah, I'm not, it's really, really funny because I am not athletic at all in any
Hmm.
sense of the way. I'm only good at
Yes, you
lifting.
are.
I'm only good at lifting. But if you give me a ball and ask me to throw it,
Mm,
it's gonna go straight into the dirt. You know what I mean? Or like if we're trying to play soccer, I'm gonna like trip and fall. Like that's because I'm a
the
dork.
hand-eye coordination.
Yeah, like I'm a nerd, you know.
Yeah,
So like even though I played soccer in high school and I danced, so I actually am coordinated, but I'm
yeah.
not athletic. Like I can't we can't just go play a pickup game of softball. Like that ain't happening.
Hmm.
And then his Christmas party was a skating rink, and I was like, no, I'm gonna fall and bust my
Ooh.
knee, you know. So
Roller skating or ice skating?
roller skating. It was at a
Oh,
skating
okay.
rink.
Yeah. See, I just can't risk any broken wrists or anything like that. I'm just too that my time has expired on being able to do that. This chick would text me back. I'm gonna text the doctor's office. I was gonna bring them some little treats to the doctor's office, but if I have to be there in an hour, I'm not gonna have time to do that. I feel like I have to bring food at Christmas. It's the Italian in me. Like I just have to do
Yeah.
it. I can't show up without a treat.
Yeah, as of right now, I have all of next Tuesday wide open. So I just texted Austin. So we'll try to get some questions together for him too.
Yeah. Yeah, yeah, yeah.
Um, and when you're down here this weekend, let's march out like some topics because I think
Okay. That's a
we'll
good
get more
idea.
viewers if we actually have something that we're talking about. Um,
Yeah.
next week too, next Friday is my laser peel. So I'm going to document that too.
Oh, good. All the recoveries. Are you gonna will she let you like record while you're in there? You should do that.
I'm sure she would if I asked her to,
Uh-huh.
especially because I do have her putting stem cells on my face right after. But I'm just
Yeah.
going to pour them on the open skin because I
You
want
should
to see
definitely do that.
how much quicker I heal.
Hmm. Like from the beginning all the way through.
Because for most people, I think it takes about a week, and then I can't
Hmm.
use like my retinols or anything for a while. 'Cause it's gonna be like baby skin. They said it's literally like infant skin.
Yeah. Wow. Just like completely like tender raw skin.
Yeah, it's a little nerve-wracking.
Hmm.
They're having a 12 days
I
of
mean, what
force and
better
stuff.
time to do it though?
Yeah, I know
When you're
because
already healing from your
I
boobies.
can't sweat or anything for a week after you get it done, and I have been wanting it done for a while, and my skin is not bad. I know that,
No,
you know,
it's actually really nice.
but it's like I have like just color inconsistencies,
Mhm.
and then like some old like sunspots. You can see it when I do that.
Mhm. Does it
Like
get rid
that's
of that,
yeah.
allegedly?
But it's
That'd be
also I
good to
think
try.
I honestly think the reason my skin looks is living its best life right now is because I don't ever wear makeup anymore. Because I don't go
Hmm.
anywhere.
Or the Sculptra, do you think?
I do think the sculpture played a huge role. And
Hmm.
there's another new one that's like that that just got approved in Europe. It's not
Oh, really?
approved here yet, but it works instantly
Oh, wow.
and continues to, so it's almost like a little bit more of a filler than Sculptra, but it also brings collagen to the area. Um,
Okay. They did text me back that 11 was good. Thank goodness. Yeah, no, we'll come up with some. We've talked about a lot. You know what I mean? I think this like, I, now the show season is over for now and stuff like that. So I think I did see that the FBB guy sponsored the Triple Dynasty. Did you see that today?
No, but that's great.
Yeah, isn't that awesome? Good for
I like
him.
them.
Yeah.
It's called Lanluma, I think, but it's a PLLA, polylactic acid option. Um, oh, maybe I'm gonna figure out what it was called because I saw it on Instagram and I didn't look at it in the moment because it was yesterday and I was like,
Mm-hmm. You're right. You're
yeah,
right.
I'm starting to feel that way now
Mm,
because I took my pain
I
medicine 45 minutes ago.
I wish I had some. I'd like to just have a nice day to sleep. Get high and sleep all day. I wouldn't want the pain of the boob job again, though. That was horrible.
When my pain medicines are in my system, like I'm comfortable right
Hmm.
now.
Yeah. And just not having like the stomach bloating, honestly, that was like one of the most uncomfortable things.
I'm
Like
bloated
that
in the
was
sense like I need to
you're a
go
little watery, like
I,
I can
I need to
see
go to
in
the
the picture.
bathroom. Yeah,
Yeah, it
but
looks a little like a film of water on you, but you don't have like a pregnant belly. Like I had like a pregnant, my boobs and my stomach were the same coming out like
that's
that.
how I was when I had my ovaries taken out. I literally just like I could grab my stomach like this, full of water. I was like, oh, I could like grab this like hunk of like, the
Belly,
yeah.
that's attractive.
I'm gonna be that way in a couple of weeks so I don't stop eating cookies. They were so
You'll
good though.
be fine. Enjoy them now. Enjoy your
My
daytime.
hairstylist,
Oh my God, what'd she say?
she goes, the way I just had a heart attack.
Yeah,
She was like, but with that tan, she's like, I actually do really like it, but I would have to be tan all the time. I couldn't do it and be
I know.
pale.
That's what I was like at first. I was immediately no, like absolutely not, and then I was like, well, it does kind of look pretty.
I've actually gone brown before, but I mean, I think I was in high school. Like it's been a long time.
I just can't.
But
Mm-mm.
it's
I can't even
so
imagine.
hard to get it back
Yeah.
blonde. One of my girlfriends, she was like, just wear wigs. And I was like,
Mm.
I, I
I
have
mean, if
this
you got
wig
like a good one,
story.
you have too much hair on your head right now to put a wig
It's
on, though.
way too much. I have to like braid
Yeah.
it like a
Yeah.
Katniss
Like
and like,
tight.
and it doesn't look good. But Zachary and I, we went to Orlando a couple of years ago and we watch a lot of Modern Family. And I don't know if you've ever
Hmm.
seen Modern Family, but one of the main married couples, they role play and they go out with like their alter egos and like meet at a bar. And so I was like, ooh, let's do like an alter ego type thing tonight. So I wore a brown wig with bangs, but I forgot my wig glue. And so we're at the restaurant and I keep like pulling the bangs down. I went to the bathroom. The end of my bangs were like up here.
That's cute.
It was like doop. And then like the part was like way back here. I literally took the wig off and threw it in the trash. And I was like, nope, I'd rather have my matted under
Did
hair.
your husband not say to you like what's going on with your what?
Yeah, because he knew it
Babe,
was driving me nuts. But what was funny was the waiter. He was like,
why
I
is
was just like,
that
can I
wig
get
so?
some gelato, please? I didn't even like acknowledge the fact that my complete head changed colors.
I would have just came over and like pulled your bangs down. Like, let me fix this for you. Hold
I just
on.
needed to get wig glue. But
Yeah, just a little wig glue.
I
Just
forgot
tack
it,
that
but
shit down.
I have a really good wig right now.
Does your husband care about your hair color?
No,
Corey would have a heart attack if I made my hair anything other than blonde. I know he would. He would not
no,
like that at all.
he
I've
just lets
threatened
me
it a
do.
couple times.
He lets me do whatever I want to do. Really, I
Yeah,
don't really care. I, he didn't love the pink.
he didn't. No, just because he thought it didn't. I thought it looked good on you though. I thought it was different. It
I
was a
liked it.
vibe. Yeah, it was a vibe for you.
I really liked it.
Hmm.
I was going back and looking at pictures, and I was like, I like it more than I thought I would, to be honest.
Hmm.
Um,
I think it was like
but
a fun change, but I definitely prefer this.
yeah, I mean, it was something. It was a bucket list thing.
Yeah.
Like, okay, I did it as an adult. I can move on now.
Hmm. Were you about to put a wig on your head?
Yeah, I was about to go get it, but actually don't know that I can do all that right
You
now.
can do
So,
it. Yeah.
because this is about as high as I can. I can like bring my head down to tuck my hair, but I can't like
Hmm.
actually do more than like that right there.
You need to like next when we do a podcast, we should just like wear wigs one day. He could just be show up like with brown hair.
Yes,
Yeah.
let's do that. We will certainly do that. That would be incredible. It would make me so happy.
Yeah.
We can do our alter egos.
Yeah, all the alter egos, eh?
So let's see,
Uh
who else can we have on here? So I think
well,
Austin's a really
I wanted
good.
to have Tessa at some point too. I did talk to Tessa and so to do that. So I think Tessa
Awesome.
would be really good. Again, and something we haven't like really specifically addressed that we've talked about for that's for both of us is like bodybuilding and working full time. And I know Tessa talks a lot about that, about doing travel nursing while like competing at an elite level. So I think she would be a really good guest to talk more about that too and how
Yeah,
she
we can
makes it
definitely let
work.
that be like the topic of the
Hmm.
podcast. Um, and then Vera,
Does Austin work? Or not Austin? That's his name, Austin, right?
yeah, no, I
Does he
think
work?
this is like he like coaches and stuff.
Hmm.
I'm pretty sure we'll ask him.
Yeah.
Um, I want to ask them what he like, how he likes working with dark too. They
Okay.
did a really cool photo shoot for him and Emily because they're getting married.
Oh, are they? Oh,
Yeah, they are. They're super cute about it.
I feel like anyone who's worked with that company always speaks like very, very highly of them and like how supportive they are.
I still get calls from the hospital. I'm like, I
Mm.
haven't worked there in 3 months. Why are y'all calling me?
Uh,
Mm,
who else could we have? Oh, that's
yeah,
beautiful.
just sweet.
That's really awesome. Oh, because they're both dark sport athletes.
Hmm.
She is too.
Yeah,
Um, hold on, let me think. Um, I mean, really any other like figure athletes, I would absolutely love to talk to. I think that would be like so cool.
yeah.
Um,
So I'll
oh, we're
talk
gonna have
to
a lot,
Vera.
Laney,
Eleni, yeah. I need to follow up with her. So
Mm-hmm.
we'll get Austin. I just texted him about a new time. He's an hour behind, so he might not be up
Mm-hmm.
yet.
Mm-hmm.
For next Tuesday. And if we can't make next Tuesday work, I'll push him out and I'll let you know and see if Tessa's available.
Mm-hmm.
And
Okay.
then I know Carissa wanted to wait till probably later in January. And I'll reach back out to Meg after we've got a little bit more. I think she needs a little bit more time, like
Mm-hmm.
then to say like next week. Um,
Okay. Yeah, like more planned out.
mhm. And then I enjoyed
Oh, and
having,
Christina. I would still love to have Christina on. We just need to make that work with our schedules. That's the tough part, is her schedules were literally exactly opposite.
well,
Like the best day was the
I'm
one
not
day.
training now, so if she can
Oh,
do
okay.
another day, you just set it up with Christina anytime
Okay.
before February 1st.
I think it was one day that the day that she said she could always
Even
do
if
was
it
a
ends
day
up,
you can't for
but
work. Is
even
it a
if it ends up
Wednesday?
being, well, now if I have enough notice, I can make it work.
Okay. Okay. Okay, good.
Um, so you just schedule it, make sure and text me and we'll confirm it and I'll block that
Hmm.
schedule right then.
Okay. Yeah. She mentioned it to me again. I'm just like, ooh, it was just tough with your schedule at that point. So
Yeah, we
like
got
that's a good
flexibility
amount.
now.
It's good. Yeah. That's like 5 or 6 people. And we can come up with some good topics other than, just us bullshitting.
Yeah. So we'll sit down and march out some podcast topics and I think that'll be good.
Mhm.
And of course, I'll always do my updates on the procedure. I thought about not doing my get ready with me's anymore, hoping it would push more people here.
Uh-huh. No, you should do it. I think people look forward to it. It's fun.
I think I had a patient, it was a really cute compliment. She was
Hmm.
like, I love that you do those because it like humanized me. She's like, we
Yeah.
have our providers and they're also professional. She was like, but it's nice to see that, or remember that you guys have personalities. She's like, well, like when you put
Hmm.
your blush on, it was like, oh my God, that's way too much. She was like, I died laughing, and I was like, okay, well, I guess I get
I
that.
think that that's true. Even like, yeah, like obviously I know, I think it's just even just like the genuineness of it. I think people like I look forward to it because it's just like something real on social media and very genuine, where everything is like a picture or so posed or like even like what I post a lot of, is like they're created reels. It's all
Right.
created. It's not like just in the moment direct or genuine. So I like it. I think you should stick with it. Personally, I
I
think
do
you
have
should.
fun doing them, especially now that for a little while there, I was always running late because I had crawls at
Mm-hmm.
8:30 every
Mm-hmm.
Monday. So I was always trying to get out the door. Because like when the weather's like this, when it's like winter solstice time and it gets dark at 6 o'clock, like
Hmm.
I just want to lay in my bed. And so I have, it's not that I'm not waking up because I'm too tired to wake up. It's just that I'm so cozy that I don't want to
Yeah,
get out of bed.
exactly.
I'm like, no, I'll stay here just a little bit longer because we keep our bedroom in the
Uh-huh.
50s. So
Yeah.
it's just like, it's,
It's nice in the bed, but it's cold in that room.
yeah.
Yeah.
So it's just like making yourself get up.
Hmm.
I'll tell you, getting up out of bed is difficult by myself right now.
Yeah,
I have to like bear
absolutely.
hug myself and I like kick up.
Like roll yourself.
What I've discovered works really well is I'll have like Zach come to the edge of the bed and I hook my feet and I just pull with my feet
Hmm.
to a sitting position. That's the best.
Just lift yourself out of the bed.
Ooh, I'm so itchy.
Yeah, I see you just a scratch, and that must be from the drugs.
Normally, I think my skin's just really dry and I didn't
Hmm.
put on a lot of lotion because it's not
Hmm.
like in a reaction because I don't have welts
Yeah,
or
no, you're
anything.
just dry.
But yeah, I'm just
Yeah.
really itchy.
Um, I was gonna say something before that, but I don't remember what my dementia's kicking in. I don't remember what we were talking about. Oh, also you say what's like honest on those two, which I really you say what I think everyone's thinking, whether you're like an athlete. Like I just think it's very natural to like be worried about like gaining weight or losing your shape or like losing muscle or like all of those things. I think athletes and even people who aren't athletes think that way, you know? But
Yeah.
like most people just don't like readily admit that like openly. Because it doesn't have anything to do with your discipline. You know, logically you have discipline, you know you won't go crazy, you know that, but just like you're still we have those thoughts, especially as a physique athlete.
Yeah,
And
and there is
so,
part of me too, and I think part of where my anxiety with it came from is like I do want comfort food,
yeah,
because it's like I just want to feel comforted, so I don't necessarily want to eat egg whites,
like the
you
double
know.
doozy.
So I want like dopamine food,
Yeah.
but
Or even to not, it's like sometimes like when I'm like that, I just don't want it's not that I want like I just don't want to eat the same thing that I've been eating. Like I just want something different. And sometimes I don't even want to eat all my meals. Like it's easier for me to be like, I just want like a big ass breakfast and then not think about food again. You
yeah,
know, like you just want to do something different,
yeah,
like for comfort.
and that's kind of where I'm at right now. Like I just want
Hmm.
to, which is why I gave myself yesterday, but today I'm like, no, because if I do it for a whole week, I will gain weight, and it won't
Hmm.
come off because I'm not moving. So. Or right now. But
Hmm.
let's see how many refill reminders are about to push through.
That's great though.
My mom got my dad the 62, the coolest gift.
Jesus.
It's a frame, a picture frame that we can all send pictures to remotely.
Oh my
So,
gosh.
like if me and Zach are doing something fun, we can take a picture and it pops up on their frame.
That is awesome.
It's like Frameo or something.
Yeah.
I'm wondering if I can. Like I want one and I want it to connect. I want us all to be able to have the
Yeah.
same. So I'm gonna
Probably.
ask her. Like
Because if you could send the pictures to one person, why
it's
wouldn't
like
you
an
be able to send
app.
them to?
Yeah, it's an
Yeah.
app. So I think if we're all on the same network,
Hmm.
but then I
That is
wonder,
so
do I have to be in
cool.
person? It's a really cool gift. Like I
Yeah.
sent her,
Like
and
what?
then
That's like the best gift for a grandparent
they
too.
change like every 30 seconds. Let me unread this text because I don't know that I replied
That
to the
you
person.
actually like comprehended what you read.
Well, I was trying to remember what Johnny said in my check-in yesterday because I know I watched it. I remember watching it, but no clue
Hmm.
what it said. Yeah, see, like it just comes over as a little frame.
Oh, cute.
I sent her some pictures of the dogs,
Hmm.
but no, it was a really good time.
Did
Did
you
you
get
find
your
out about
Christmas
your
present
appointment?
yet? Oh yeah, I did. They said 11, so I'm good.
Okay. What did you say?
I What'd you get for Christmas? Are you getting a present on Christmas or you get like the massive?
Yeah. We did ours this weekend. So I got a neck massager that I
Oh,
wanted. It
nice.
works so good. It's so
Oh, you
good.
already used it?
Yeah, I busted it out while I was at my parents' house. And I actually left it out for here, like to use because
Mm-hmm.
it doesn't mess with my chest at all. And it just sticks and it hits that really difficult to get spot
Mm-hmm.
that hurts really bad. And I'm just, oh, it's so nice. And
I just
then,
don't, I see those like on apps and stuff, and I'm just like, I don't know if that, sometimes I think like, will that hurt more than it helped?
yeah, no, I really, really, I'll let you try it this weekend.
Mm-hmm. I need to try it because I have so much tension there too. I think that's just, Lily's just staring at me from the top of the steps. What a weirdo. I just looked up and she's just staring at me.
My boys, my Frenchie boys, they do that. They just
Lily.
stare. They just stare at me.
What'd you say? You froze for a minute.
Oh, my Frenchie boys.
Damn it. Frozen again. Why do you keep freezing now? What is going on?
It says
Honey?
my
Oh, there
internet
you
is
go. You're
unstable.
back.
It's probably because
Hmm.
he's playing his video game downstairs. It takes a lot of the power. Um,
Oh,
I said my Frenchie boys are
we're gonna
like
have a
that.
nice setup in our new. What's that?
My Frenchie boys are like that. They just stare.
Stare at you.
They just stare at me. They look at me
Like
like they
little,
love me. They're just like,
like I know, but this was like creepy because all I saw
um,
was like her head from like
just
the
like
top of
this.
the steps. Yeah, like sometimes like looks at me like she wants to kill me.
That's so funny.
Um, but we do. Corey got like this very fancy computer for our new house, and we got a webcam and like the whole setup. So I'm gonna have a much better setup in our new house.
That's
Very
awesome.
excited about that. Yeah, he went a little bit crazy. That's the only problem. Well, it wasn't a problem for me, but like when you're not working out, like his dopamine hit was like shopping. So yeah,
Yeah,
like every day it was like spending massive amounts of money. I'm like, let's maybe slow down just a tiny bit.
yeah, I saw the Ring app last night and there was like, I think I had like 7 packages arrive yesterday because all
Oh
of
my
my
God.
Black Friday shopping that took forever to come from
Yeah.
China finally shipped. And I was
Mm-hmm.
like, Zach was like, what the heck? And I was like,
I
don't
think
even know. And I did the dumbest thing the other day. I had this really nice Carhartt fleece jacket and it's black, but it has like dark brown accents. It's just really, really nice. It's like a half zip with a pocket, whatever. And I was freezing in the house, so I ran to go get it. This is obviously not today, but I went and got it. And I always have a candle burning, and someone called me,
oh,
so I set the jacket down on the counter into the candle
on the
and it
candle.
went into flames. And so
Oh my God.
luckily this jacket was like out 5 years ago. They don't have it anymore, but like some place called Boot Barn had it for $50. So I
Oh,
got another
nice.
one. I was like, oh my gosh. I told Zachary, I was like, I did a dum dum today. I was like, I
Yeah.
literally like now there's like black, like melted plastic all in my candle.
Oh, at least you didn't burn your house down though, dude. That could have been really, really bad.
Oh, I screamed.
If
Like
you
that
had like
is
walked away or like whatever.
I was standing right next to it, luckily.
Yeah.
But
Yeah.
it literally is my worst nightmare that the house catches on fire.
Yeah.
Because like Zach's like, why don't you sleep naked? And I was like,
Mm-hmm.
because if anything ever happens, I want to be dressed, so I'm good to go. You know, my one of the
Not
ladies I'm
running out of your
friends
house
with,
naked, chasing your dogs down.
right? I was like, she wears scrubs to bed.
Hmm.
I had a pin up here, and it's driving me nuts because I can't find it. And I don't want to. I can't go downstairs because I can't combat the dogs. That's the hardest part of this is not being around my dogs.
Is your husband gone or he's there?
He's downstairs.
Oh, okay. You
I
text
just
him to
have,
bring you a pen.
well, I have to call him because he's playing video games, so he won't check.
Oh, so he will look at his phone. Yeah.
But it's okay because I need more coffee too. And I'm gonna work a little bit, I think, and then
You
go
need to
back to sleep,
sleep. Yeah. You need
watch
to
a
definitely
movie or
get some
something.
sleep. You need to watch the Olympia movie so we can talk about it.
Okay.
Yeah.
I
If
would
it
put it on
keeps
my
your
list, but I
attention.
don't
It
have a
kept my
pen.
attention just because it's Uh,
Salty about my pen being missing.
I know, I can see that. Don't hit your head or fall out of your chair.
No, give up. It's all right. Okay. So I'll see you Saturday. Um,
Okie dokie. We probably will leave it like the ass crack of dawn. Like he does not like waking up early, but you know how I get up super early. So
he can sleep on the way and y'all can take turns.
yeah, take turns. Yeah, right. We know who'll be driving.
And I'm super excited. And the guest
Yeah.
bedroom is ready to whatever y'all
Okay.
decide to do. It does not hurt my feelings one way or another, I promise.
Okay. No, no. I made the reservation, but I told him, and I said that the cats are separate in the house, and he was like, "Okay, well, we can try." And he's never specified to me one way or another what he wants to do. So I'm like,
Okay.
okay, I'm just
That'd
gonna
be
let
good.
him decide. All right, honey, sounds good. Get some good sleep.
Yes.
I
Can't
hope
wait
you
to
feel
see you.
awesome.
And then, all right, listeners, we're gonna have real topics soon. So I wish people engaged more with like the story when I post, like, hey, what
I
do you want to hear
know. I need
about?
to do that too. Do people not?
Not really.
I feel like
I
people
go
just
through
don't engage
phases.
in general, which is weird.
Yeah, I either get like a ton of engagement or none. There's no
Yeah.
like I have posts that get like 700 or 800 views, and then I get posts that get like
Hmm.
120,000. And I'm like, what kind of freaking algorithm crap is this?
Yeah. I just it is shocking to me because like I'll ask a question and a lot of people will like I'll think it's like a stupid question and people will answer a lot on that and then I'll ask one that I think a lot of people are going to engage with and they don't.
You know what I think would be fun?
Yeah.
If we both posted gym pet peeves and then read them out here.
Okay. Yes. Let's do that. Like ask what people's gym pet peeves are.
Yeah, and then we'll read them out
Okay.
loud here and then converse about them.
Okay. I'll do that today so I get enough time for response. I'll have to post it probably twice to get enough responses.
Yeah, and then we can just screenshot them and read them. I think that would be fun.
How did you
Or
just think of that? Your brain is working good. Look at that.
I don't actually know what made me think of it. It was something you said,
Oh,
but I
I don't
definitely
know.
have like the ADHD like flight of ideas, you know.
Yes, I know. All right. I'm gonna go to my appointment. I will talk to you later. Get
All
some
right.